Welcome. I'm Carolyn Smith with the Marketplace Agency and Eldercare Associates. Thank you for joining us today. We are an insurance brokerage with a combined experience of more than 50 years. Our home office is located in the beautiful Shenandoah Valley of Virginia. Our team is nationally recognized as a leader in the insurance industry. We provide better value, better choice, and most importantly, personalization for every client. We make sure that our clients choose the right health plan based on their individual needs, that they fully understand their benefits, and that they are able to utilize their health care providers. We precisely calculate and project your individual out-of-pocket costs and benefits for your current coverage, and then we compare these options to all available plans on the individual marketplace. We represent many of the credible insurance companies that you know and trust. This allows us to work directly for you to fit your needs to the right company. Every single day in the United States, over 10,000 Americans age into Medicare. Here are the things you need to know about your health care options when you turn 65. What is Medicare and how does it work for you? Medicare is health insurance for people 65 and older, under 65 with certain disabilities, and people of any age with end-stage renal disease. Medicare is administered by the Centers for Medicare and Medicaid Services, known as CMS. The Medicare Modernization Act was enacted in 2003 by President George W. Bush. It produced the largest program overhaul in Medicare's 38-year history. Beginning in 2006, a prescription drug benefit called Medicare Part D was made available through private insurance companies. The MMA also changed the Medicare Plus Choice plans into what is known today as Medicare Advantage plans. These plans are offered by private insurance companies as well, who are paid a fee by Medicare to administer Medicare benefits. The Patient Protection and Affordable Care Act was signed into law by President Barack Obama in 2010 and further reformed functions of the Medicare program. Medicare now covers preventive services that used to be subject to coinsurance and deductibles. You can now get a yearly wellness visit and, in addition, many preventive screenings and immunizations. Medicare has 4 parts that all work together to fully cover your health care needs. Part A of Original Medicare, which is your hospital insurance. Part B of Original Medicare, which is medical insurance. Part C, which are the Medicare Advantage plans. And Part D, which is your prescription drug coverage. Beneficiaries who are receiving Social Security benefits or Railroad Retirement Board benefits are automatically enrolled into Medicare Part A and Part B. Your initial enrollment package will be mailed 3 months before the month you turn 65 or the 25th month of receiving disability benefits. Others must enroll themselves. Once you receive your Medicare card, you can keep it and accept Medicare Part A and Part B, or return it to refuse Medicare Part B. People on group coverage need to contact us, and we will work closely with your group benefit administrator to determine exactly how your coverage works with Medicare. If you're not automatically enrolled in Medicare, you will have a 7-month window to enroll to avoid the late enrollment penalty. You will have 3 months before you turn 65, the month you turn 65, and 3 months after to enroll. This is called your initial election period, or IEP. If you don't have coverage from an active employer or group plan and do not enroll in Medicare Part B, you may pay higher premiums. If you do have coverage through an employer or group plan, you may want to delay enrollment into Medicare Part B. You will have no penalty if you enroll while you have coverage or within 8 months of losing your coverage. Keep in mind that Medicare does not recognize COBRA. Let's discuss the basics of Original Medicare. Medicare Part A is your hospital insurance and provides coverage for inpatient hospitalization, skilled nursing facility care, home health care, hospice care, and blood. Medicare Part B is your medical insurance and provides coverage for your doctor and nursing services, medical and surgical services and supplies, lab tests, durable medical equipment, and preventive services. In 2015, you will pay a $1,260 deductible for days 1 through 60 in the hospital. The 61st through the 90th day, you will owe $315 per day. Days 91 through 150, you will pay $630 per day, which includes 60 days lifetime reserve days that you can use once in your lifetime. After 150 days, you are responsible for all costs. This cost sharing is for hospital room and board only and does not include your medical expenses. Medicare pays for the first 20 days in a skilled nursing facility. From the 21st through the 100th day, you will pay $157.50 per day. Medicare will only pay for the first 100 days. Beyond that, you will owe all costs. Medicare only covers skilled care in a nursing facility and does not cover long-term care or custodial care. Also, Medicare requires that you are confined to the hospital for at least 3 days prior to entering the skilled nursing facility. Home health care is covered by Medicare as long as you need skilled care. Medicare pays for your care on a part-time or intermittent basis. Durable medical equipment is covered under Medicare Part B, and you will pay 20% of the Medicare-approved amount. For all of your medical costs under Medicare Part B, you will pay a $147 deductible once a year. Medicare's calendar year runs from January 1st through December 31st each year. After you meet the deductible, you will pay 20% of the Medicare-approved amounts. Under original Medicare Part A and Part B, you have no max out-of-pocket limit. You just keep paying the deductibles and coinsurance no matter how much you owe in healthcare costs. This chart shows the different ways you can have Medicare coverage. You can either have original Medicare Part A and Part B, or you can enroll in a Part D prescription drug plan and add a Medicare supplement policy, or you can have a Medicare Advantage plan that combines your Medicare Part A and Part B coverage and usually includes a Part D plan. Some Medicare Advantage plans may allow you to add a standalone prescription drug plan. I will now discuss Medicare Advantage. Medicare Advantage plans known as Medicare Part C are health plan options that are approved by Medicare and run by private insurance companies. If you are enrolled in a Medicare Advantage plan, you do not lose your Medicare coverage and you are still enrolled in the Medicare program. You still have all of the rights and protections provided by Medicare, and you still get all of the Part A and Part B coverage. Medicare Advantage plans may include extra benefits like dental or vision services. Benefits and cost sharing are usually different than original Medicare. In order to enroll in a Medicare Advantage plan, you must reside in the plan's service area, you must be enrolled in both Medicare Part A and B, and you must not have end-stage renal disease. You must also provide necessary information to the company, follow the plan's rules, and you can only belong to one Part C plan at a time. You can join or switch Medicare Advantage plans during your initial enrollment period, which is a 7-month window that begins 3 months prior to the month of your 65th birthday, includes the month of your birthday, and ends 3 months after the month of your birthday. Or you can enroll during the annual enrollment period known as the AEP. That runs from October 15th through December 7th each year. You can also join or switch plans if you have a special enrollment period, or SEP. If you move out of your Medicare Advantage plan service area, your plan leaves your service area or the Medicare program, you leave or lose group, employer, or union coverage, or if you enter, live at, or leave a long-term care facility, you qualify for a special enrollment period. Also, you have a continuous SEP if you qualify for extra help or low-income subsidy. You will have a special election period to switch from your Medicare Advantage plan and enroll into a 5-star rated Medicare Advantage plan at any time once each year. You can leave your Medicare Advantage plan and return to original Medicare during the annual disenrollment period that begins on January 1st and runs through February 14th of each year. There are many different types of Medicare Advantage plans to choose from. Each plan type has different levels of network restrictions, cost sharing amounts, and utilization management. Not all plan types will be available in your area. Network matters. Make sure that your providers are in network to save money. Now, let's talk about Medicare Part D prescription drug coverage. Medicare Part D is a voluntary program. Plans include a list of covered drugs known as formularies. You pay the plan a monthly premium. You also pay deductibles and co-payments for your prescriptions. If you have limited income and resources, you may be able to get extra help. You can join or switch Medicare prescription drug coverage during your initial enrollment period, which is the 7-month window we discussed earlier, during the open enrollment period, or you can enroll during Medicare's annual election period. You can also join or switch plans if you qualify for a special election period. For 2015, a prescription drug plan can charge a maximum deductible of $320. After the deductible is met, the member will pay up to 25% of the cost of their medication until their total drug cost reaches $2,960. At this point, the member will reach the donut hole, a coverage gap where they will spend an additional $3,720. Then the member has reached their true out-of-pocket spending limit of $4,700 and will move to the catastrophic phase where they will spend $2.65 for generics and $6.60 for brand name medications, or no more than 5% of the cost of their medication, whichever is greater. The Medicare Part D coverage gap or donut hole is shrinking incrementally. Medicare beneficiaries will receive a 55% reduction on brand name and 35% reduction on generic medication costs in 2015. This chart reflects the closing of the donut hole. There will be a gradual decrease in prescription drug costs, and the coverage gap will be completely closed by the year 2020. If you wait to enroll in a Medicare Part D plan and do not have credible prescription drug coverage or get extra help, you will be faced with a late enrollment penalty. This penalty is 1% of the national base premium for each month that you were eligible for coverage and not enrolled. The national base premium in 2015 is $33.13. Extra Help is a program designed to help people with low income and resources pay for Medicare prescription drug costs. If you qualify for Extra Help, you will not have a donut hole or a late enrollment penalty. If you get Extra Help, these are the amounts that you will pay for your prescriptions in 2015. Plans are required by CMS to cover a range of drugs in each category. Coverage and rules vary by plans. Plans can manage access to covered drugs through formularies, which is a list of covered drugs. Prior authorization, this is where the doctor must get approval. Step therapy, other drugs must be tried first. Quantity limits, this limits quantity over time. Utilization management tools or plan restrictions are methods that Part D prescription drug plans use to reduce their costs. Many Medicare drug plans place drugs into different tiers. Drugs in each tier have a different cost. Some plans may have more tiers and some may have less. Part D plans are not required to cover all Part D drugs. They may establish their own formularies. Excluded drugs are not covered under Part D, even if they are prescribed by a physician. With a Medicare Part D prescription drug plan, network matters. We have just a few more slides. I know that we have covered a lot of information. Finally, I want to talk to you about Medicare supplement insurance policies, also known as Medigap. Medicare supplement policies are health insurance policies that are offered by private insurance companies to help pay for coverage gaps, which are Medicare expenses like coinsurance and deductibles. A Medicare supplement policy works differently than Part C Medicare Advantage plan. A Medigap policy will supplement your original Medicare coverage, while a Part C Medicare Advantage will pay instead of original Medicare. Medicare supplement policies are easy to understand and compare because these plans are standardized, meaning that amongst all of the different insurance companies who offer these policies, plans with the same letter A through N each must cover the same basic benefits. I'll show you a chart in a few seconds that will help you visualize this more clearly. Any standardized Medigap policy is guaranteed renewable, meaning they can't cancel your coverage as long as you continue to pay your premium. Some of the Medicare supplement policies even include benefits that cover you for foreign travel emergency care. The monthly premium rate you pay is the only difference between like plans. These premium rates may change, and we are always on top of these changes so that we can make sure that your policy's rates are competitive year after year and that you are with a company that provides you with good service and keeps you happy. When you turn 65 or first enroll into Medicare Part B, whichever is later, you will have a 6-month Medigap open enrollment period, and the insurance companies cannot refuse to sell you a policy. If you are still covered under active group health insurance benefits, you may want to delay your enrollment into Medicare Part B. When you lose this coverage, you will have a Medigap open enrollment period to purchase a Medigap policy. If you are losing your group coverage, you will have guaranteed issue rights into a Medigap policy within 63 days of losing your credible coverage. This chart shows you all of the benefits included under all of the standardized plans A through N. Take a moment to review the chart. We are always here to answer any questions you may have. With a Medicare supplement, there are no provider networks. You have the freedom to go to the Medicare provider of your choice. Making the right Medicare choice is important. We will guide you through the process every step of the way. Thank you for joining us today. If you have any additional questions, you may visit our website or contact us directly.